I just think we need to make older age in California a thing that works for everybody and is something that we, again, celebrate the progress we've made, and make it an opportunity rather than this thing we avoid. It's really about like helping people live as older adults in the state of California and live well. AARP does this every few years. They ask people 50 and over, like where they want to live, where they want to age, and people say at home. And that's a great aspiration. And hopefully we all can do it. But then you think about like where you live, the like steep slope and steps and, bathtub you need to like walk over to get into the shower and all these things that actually, when you get really old, which hopefully we do, like it's a really good thing, becomes really hard. It's hard to manage in that home that you had, or even apartment that you had, raising your kids or working. And so I think we need to think of alternatives, whether it's, retrofitting someone's home or just thinking about other living spaces for people. If you're rich, like there are lots of great opportunities. But not everyone can afford $1 million entry into a continuing care retirement community. And on the other side, there's like, if you're super frail, you can go to a nursing home, and we have Medi-Cal helps pay for that. Medicaid is really the single largest payer for long-term care, and nursing home in particular. And so, we kind of got that covered, but it's this big group of people who don't have the resources to be in these high-end places or aren't kind of sick enough. I mean, I really think a lot of people just struggle. You have like the whole family trying to chip in and make it work, where chip in is money, time, effort. And then some people are really lucky and they do age without getting really sick. I mean, it's a lot to coordinate. People who do stay at home successfully will have often not just family members, but home health aides come and help them with what we call activities of daily living. So eating, bathing, things like that. Medication management is another one. Scope of practice laws have very clear definitions of what different types of people can do. And so we have actually quite restrictive scope of practice rules about what a home health aide can do and kind of a home health like nurse essentially can do. And so someone can come into your home and help you bathe, but actually can't give you medication. And it creates, again, like layers of bureaucracy and probably added costs to be able to get the care that you need to live well at home. So certainly kind of tackling scope of practice, which is really difficult, is something that could kind of enable people to live more successfully at home. I mean, imagine you just had one person you needed to, or one type of person you needed to work with to facilitate living in your own home longer. That would certainly be easier. I think we probably need to look at maybe relaxing rules with the goal of creating kind of more opportunities for people who, again, aren't at the two extremes here. When I think about the progress that I hope we can make, I think a lot about the just really licensing and regulation around kind of group homes and assisted living that is really quite onerous. You can't really open a facility unless you have a lot of money on the table available to you. It's a big risk. You're only going to do that if there's this big return at the end of the day. And so can we have some flexibility on that type of thing? It seems to me that there's this opportunity to revisit these and look at ways to make progress and kind of spur innovation in terms of, opportunities for people to live outside of their home, but not in an institutional setting when they're older. California actually is kind of a young state compared to some other states. Like if you think of Florida or even Arizona, we have a lot of young people, and so there are 6 million people who are 65 and over, and that's going to grow to 9 million by 2040. So there's a lot of people. 1 in 4 residents is going to be 65 and over in 2040, and 1 in 13 will be 85 and over. But we have this opportunity now, I think, to plan for that and make progress where we're still a relatively young state.